Hi, I'm Dr. Heather Ingbretson, and I'm here to talk to you about quantum neurology, specifically the GRT light, and whether or not you need this. Frankly, I haven't told any of my patients that I have this, unless I specifically think that they have an existing injury, but I want everybody to know that I have this. The fact of the matter is, I've been in practice for about 12 years and I've seen a lot of injuries to the head where you get hit, and what happens is that the area responsible for eye movement and tracking actually gets injured, and a lot of people have underlying damage to this part right here that has to do with vision and or certain parts inside the brain. The superior colliculus, you don't need to know that stuff. The long and the short is, as your eyes move or as other objects move past you, your eyes should move smoothly. So your eyes should just move along with the object really nice and smoothly. If you get hit in the head and you start getting headaches or things start to look a little fuzzy, you may have one of these injuries. I can do a quick screen at the office and find out for sure, and if you need it, we can fix it within minutes. So if you want to look at a friend and see if they have the issue, just look at their eyes when they track. You could do a little H pattern. That's what we doctors do, right? You want to do a really big H pattern and take a look at the eyes and see if they do a little jig, sort of like a sprinkler. When they go ch 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 ch, if there's a little hesitation in there. Or when they go from one object to the other, they should just lock on. But sometimes they'll do a little jog or a little hesitation, and then they go a little bit to a different, it's almost like a little Nike swoosh or something. And if that's the case, you may need the GRT light. This is super cool, and I can fix these things in about 2 minutes. Sometimes it takes a couple of different treatments, but you'll notice an immediate difference. I've had patients drive home telling me that honestly, they see things clearer. I've had patients right in office notice immediately that things look clearer, and then they get fewer headaches. Now, if you don't treat it, what typically happens is that the headaches continue, and it can take years for the brain to heal itself. But what this does is it actually stimulates the nervous system and gives it a little extra push. If you think about that shakiness in the eyes, sort of like a bicycle, when you're going too slow, you're kind of shaky, the wheel goes side to side and you're a little wobbly. This is like giving the nervous system a little push. And if you take that person on a bike and you give them a push, you're like solidifying out that signal, and you just stabilize that bike. It's sort of like putting high pressure in a garden hose that's got some mud and gunk in it. It just opens up the flow, and usually things continue pretty well. I've had patients need only 1 or 2 visits and they're fine, and then I've had a couple who had really bad injuries and they needed a couple more than that, or if you re-injure yourself. So if you want a quick screen, call our office. I'm happy to screen people for free. I just really feel strongly that if you have a vestibular injury, is what it's called when your eye trackings is different, that we check you out and make sure, and if we can, to help you live a little bit better life, right? Okay, so let us know.